Entonox is something available to you to cope with birth that you could use for a home birth. Your midwife would ensure that you had a canister to use at home, or it's on tap if you choose a hospital birth. Entonox is made up of 50% oxygen and 50% nitrous oxide. I'd say it's a very commonly used option for coping during birth. Around 90 to 95% of women choose to use it at some point in their birth. The way it's taken is that as soon as you feel the contraction coming on, you need to start taking some deep breaths. And the reason for this is that entonox takes around 20 seconds to get working. If you wait until the contraction is reaching its peak and then start to use the gas and air, it will likely have very little effect. The gas and air is taken through a mouthpiece like this. It also really helps you to focus on those long, slow, smooth, steady breaths to take the gas in. So as soon as you feel that tightness come on, you'll take the mouthpiece right into your mouth and you'll take a big deep breath in, and then you blow back down the tube. And you just keep taking these breaths all the way through until the contraction ends. As you're taking it, if you think that it's not helping, just keep going with it, because perhaps another breath or two, it will kick in and become effective. So I'm just going to put the mouthpiece into my mouth and show you how you would take the breaths. Okay, so keep taking long, slow, smooth, steady breaths all the way through. We ask that entonox is for mums only. We don't encourage partners to try it. The beauty of entonox is it has no effect on the baby. It's purely inhalational. And another great benefit of the gas and air is that as it takes 20 seconds to work, 20-30 seconds of stopping using it, then the effect is gone. So you're not left with any long-lasting effect should you try it and decide it's not for you and you don't enjoy it. It's on tap in all of the rooms. We also have mobile canisters. So perhaps if you're in hospital in the early stages of the birthing process and your choice is that you don't wish to go home just yet, it may be that we suggest you try one of the deep baths on the unit. And if you did need some extra help and you tried paracetamol and maybe a small dose of codeine, which is a slightly stronger pain relief you can take alongside paracetamol, it could be that you use a little bit of gas to help you feel relaxed. So there are canisters we can take into the bathroom should you need it. It works really, really well. And as I said, it's very, very commonly used to support keeping comfortable and to support coping mechanisms. The tubing on the gas is really, really long, so that really accommodates your active birth of being upright, forward and open, and you can sort of move around a little bit with plenty of length on that tubing. Gas and air has very few side effects. It may make you feel a little bit dizzy and lightheaded. It may make you feel a little bit nauseous, but so too can the birthing process. So was it the gas or was it just part of the birthing process? It can also dry your lips and will probably make you feel quite thirsty. So having a lip balm in your bag that you can just pop a little bit on in between, and definitely having a drink to keep having a sip of in between. Diamorphine is an opioid drug that you may choose to have during the birthing process to help feel that the contractions are more manageable and also to aid relaxation. It's given in injection form, and the amount that we give you is dependent on your weight. So the midwife would ask if we could weigh you so we can calculate that we're giving you the right amount of the drug. The injection is given into the big muscle either in the top of your thigh or into your bottom. We know that diamorphine can cause sickness, so we mix the diamorphine with the drug for sickness. So it's one injection with anti-sickness medication and diamorphine. The way that diamorphine works is that it takes you away from the pain, so it makes you feel more relaxed, more at ease, helps to bring your adrenaline down, so that you still will be aware of the contractions and feel them, but you'll be a little less bothered about them. And it really works well. Sometimes that anti-sickness medication doesn't work effectively for you in which case we would give you a slightly different anti-sickness drug in a second injection. The diamorphine typically lasts between 2 to 4 hours, and you could have a second injection after 4 hours if you chose to. The diamorphine may make you feel a little bit sleepy and enable you to curl up and get some rest. It could be that the diamorphine does make you quite drowsy, in which case it's really important to be careful when you're moving around. We wouldn't recommend using the pool in that first couple of hours after receiving diamorphine, because we wouldn't want to put you in a big pool of water if you had any drowsy effects still. The diamorphine does cross the placenta, so it can have effect on the baby. So diamorphine is not a drug that we would recommend if we thought that birth was going to be imminent. However, saying that, diamorphine is a really safe drug to give, in the respect that the majority of babies who receive diamorphine will be absolutely fine at birth, and they're delivered and brought up skin to skin, and with a little bit of a rub down with some nice warm towels, they kind of come to and start to breathe spontaneously in that first minute to 90 seconds. From my experience, I'd say about 9.9% of babies whose mums receive diamorphine during birth may need a little bit of support with some oxygen in that first couple of minutes after birth. That they're born and we give them a rub down and they don't start to breathe spontaneously. So for those babies, we would give them some inflation breaths of oxygen just to inflate the lungs and get the baby woken up and breathing spontaneously. The other 0.1% of babies we may need to give a drug to reverse the action of the diamorphine. But in the 18 years of me practicing as a midwife, I've never seen that given. So I want you to understand that it is a safe drug in that we can reverse the effect if needed.